Welcome back, everyone. The coronavirus outbreak has rocked the nation in more ways than one. Businesses are shut down, restaurants closing or are left to hold only half their capacity. Sporting events also canceled and so on. Life as we know it today simply is not the same right now. Many of you have been asking why. Some thinking it's unnecessary. Joining us this morning from Bernalillo County to talk about all the questions you've been asking us, Emergency Management Director Richard Clark. Thank you so much for joining us this morning.
Thanks for having us on.
You bet. As you can tell, we're practicing our social distancing here.
Yeah, exactly.
We measured this out. We want to make sure that we're being safe here. Let's talk first about how many confirmed cases do we have in the state right now?
Well, we're right around 21, and so we're kind of, and it fluctuates every day because testing's increasing, and so therefore we're gonna see more come up as we go along.
Right, and that's what we've been mentioning, is that there's more testing sites, there's more tests being done, so medical experts are expecting that number could potentially go up, correct?
That's correct, and it doesn't mean that all of a sudden, oh my gosh, there's a lot more here. It just means that we've had the ability to test more, and we're getting more tests into the state, and so therefore we expect to see more cases come up.
Now I know our number is low. It's in in the 20s compared to other states like New York and California. We've been hearing from a lot of people asking why are we closing down businesses? Why are we forcing people to work at home? What has Bernalillo County done to help with all of this?
Well, in the county itself, we've implemented our continuity of operations plan, and so that includes teleworking, that includes social distancing, and so that we can still provide the necessary services to the citizens of Bernalillo County, but maintain the health and welfare of both our citizens and our employees, and that's what we really care about.
Absolutely. And across the state, we've also implemented where 100 people or less, and even some restaurants, they're at 50% capacity right now. They're not allowed to go over that. For folks who are wondering if it's necessary, explain the pandemic curve to us. Why is it necessary to do this?
Right, and exactly, and that's why you saw a lot of cases more in New York and so forth, because when it first hit, we were trying to flatten the curve. We're in the process of flattening the curve here in New Mexico, and what that really means is that with social distancing, with people being apart from each other, the person-to-person contact and the spread of the virus is a whole lot less because of the fact that we know we'll see cases, but we don't want to see them all at once because we don't want to overwhelm our medical and healthcare providers. We want to be able to get them systematically, and so that we can kind of just flatten that curve and not just get them all at once and like I said, overwhelm our systems.
Right. I know state officials have also talked about that. So when you talk about the pandemic curve, what we're talking about is if we have a peak of this high and our healthcare services can only handle this much, that's when you're going to see an overload of the system and potentially deaths or people not getting adequate treatment, right?
That is exactly correct, and that's where we overwhelm our ERs, we overwhelm our doctors, our medical staff, and then they start getting sick because we got a whole lot more cases. And so therefore, that's why that social distancing is so important. Having those restaurants where we're 6 feet apart from each other, we're not spreading it as much rapidly person to person, and that's exactly important.
Now, I know we've also seen the studies where the elderly are the most vulnerable to this, but if I'm in my 20s, I can still be a carrier, and I could still spread the virus around, right?
That is correct, yeah, and in some cases you may not even know you have it, and so some of the symptoms may not be as prevalent in some people as it is the others, and so what we're asking, especially for a grandma and grandpa and our older population, is yes, we love them to death, but let's protect them as well and keep that social distancing for them as well.
Yeah, have them stay isolated. For the rest of us in the community, for the 20-year-olds, the 30-year-olds, even the 40-year-olds, what are you asking them to do at this time?
We're asking you to wash your hands. We talk about wash your hands, cover your mouth when you cough, don't touch your face. All those things that you need to do just for the normal flu season. Take those preventive measures, do that social distancing because the spread of virus, from person to person. So we're asking you to be vigilant. We're asking you to not panic. We're asking you to be informed and not afraid, because that's the big thing. Don't do a run on your stores. I mean, our supply chains are good. We're not going to run out of things, so you don't have to stock up and hoard things.
Right, because more trucks are coming in.
Yes, ma'am.
But if everybody floods those stores, that's when it becomes a problem.
Exactly.
Talk about the EOC, activating the EOC. What does it mean for the county?
Well, the EOC is our Emergency Operations Center, and we're at level 3 right now, which means that we've increased our personnel in the building so that we can, now that the county is on the continuity of operations, and we can ensure for continuity of government, we can ensure that those services, those important services, are taking place, and we can support those departments, the sheriff's department, the fire department within our county, and coordinate resources if they need them if this gets worse.
Right, and that's what you guys have been preparing for.
Yes, ma'am. We've been preparing this for years. We do drills and exercises. We've been monitoring for about now 2 months now, and so therefore we're ready to go, and we actually have a good team in place.
Of course, as you guys have been telling us, there's a number on your screen. If you do feel that you have some type of symptoms, maybe you've traveled out of the state or you've come in contact with somebody who's the COVID-19 positive, call that number first, 855-600-3453. They will assist you to let you know if you fit the criteria to be tested, and that could potentially help stop the spread.
Exactly, that is correct.
Stopping the spread and reducing that curve. If you want more details about the pandemic curve and what you can do to help stop it, go to our website that's always on KRQE.com.